Hello, everybody. Welcome back to the Ageless Anatomy podcast. My name is Darcy. I am one of the certified laser technicians here at Ageless Anatomy in Phoenix, Arizona.
And I am Brooke. I am also a certified laser technician at Ageless Anatomy, as well as one of the business partners.
I'm Dr. Brianna Cain, and I'm a board-certified Naturopathic Medical Doctor here in the state of Arizona, and I am a partner at Ageless Anatomy.
And we are actually, I would like to hear Dr. Cain's story about how she ended up choosing the path that she chose to go on as far as
How it all began.
being an ND, how it all began, and what her childhood was even like up to that. When did it occur to you?
This doesn't sound very interesting.
It is interesting. That's interesting. People want to know.
People want to know.
You don't share enough.
There's nosy people out there. They want to know.
Right? And we do.
Well, I was born in Great Falls, Montana, and I was raised in Albuquerque, New Mexico. And my family has always treated primarily with alternatives and a lot of herbal and energetic medicine. So that's kind of what I was exposed to growing up. And then as I got older, I went through school. I had a strong interest in science and math. And I thought that I wanted to be a veterinarian at one point. But I have a lot of compassion for animals, and I don't think that I could do to them the things I do to humans. But anyways, not that I don't have compassion for humans, but it's easier to communicate with humans, right? They can express themselves to you. So I had an experience then in middle school where I was invited to join a group to go to a research facility in Santa Fe, New Mexico, where they did cardiology research. And we got to dissect and hold and mess around with human hearts. And I was really inspired by that, and I decided to switch course and focus on human medicine. So I started down that road. I, got all of my prerequisites, went to college thinking that I would go to medical school. I did some volunteering at some hospitals, and I started to realize that the Western model was not really for me. It wasn't what I knew as a child. It was not what I was used to as far as, treating your body in a way where you are working with it instead of against it. And also, I didn't like the way doctors were treating patients in the conventional model. They just were a record number. They didn't know anything about who these people were. I think the average office visit time with a Western medical doctor under insurance is maybe 8 minutes. So you can't learn.
I didn't realize that.
Yeah, you can't learn much about a person in 8 minutes. You certainly can't go through their whole health history and do a physical exam in 8 minutes.
Right.
So I didn't like that. And then I discovered that there was an alternative path and that there were specific schools. At the time, there was only 6 of them in the country, I believe, that taught naturopathic medicine. So the difference between what I do and what a conventional MD does is that in addition to knowing all the pharmacology, minor surgery, exams and imaging, I also know alternatives such as homeopathy, herbal medicine, acupuncture, physical medicine, hydrotherapy. So I have a few more tools in my bag to make it a more integrative approach. And I spend a lot more time with patients. So anywhere from, 20 to 60 minutes on average in a visit. And it gives me an opportunity to teach them. So the word doctor actually stems from the Latin docere, which means to teach. So that's really my job, is to educate patients about their health, about their risk factors, and about what their options are, and then give them the power to make decisions over their own health. I'm there as a team member. I'm not their, superior, nothing like, I think a lot of people feel like their doctor is just telling them what to do and they don't have a choice. But you do have a choice, and you deserve to be educated properly about your body and then make choices for yourself that you're comfortable with. That also makes patients more compliant with their treatment protocol. So here we are today, and that's what I've been doing for the last 13 years.
So I have a question. Do you have any questions?
Not yet.
I have a question. When you originally came out of school, when you were licensed, did you know that you were going to treat patients with hormones and things like that you do now, or did you switch somewhere down the road, or?
I didn't really know what I was going to do. I initially came out thinking that I was going to do more primary care, just a general medicine. And it's difficult as a naturopathic doctor because we don't have residencies the way medical MDs, regular MDs do. So when you go into a residency, then you kind of have the opportunity to specialize, and then you kind of just sort of follow that path and get hired by a hospital or another group practice. But with us, we have to be kind of entrepreneurial. We kind of have to find our own way. However, I got lucky to be hired as the medical director at the National Laser Institute right out of school. And the CEO's intention at that time was to start a hormone program where we would teach physicians how to do hormones, basically how to balance hormones, more specifically how to do dermal pellet insertions. So I got a lot of exposure to that. I had a really fabulous mentor who introduced me more to the functional side, more the hormone balancing, nutritional therapies, IV therapies. And so between the two opportunities, I sort of started to specialize and hone in on more cellular and functional medicine. But at first, it was a lot of hormone balancing, which is such an important piece when it comes to medicine, especially when it comes to our aging population. We get, but even younger, I mean, we're to the point now where our environment is just so toxic and we're exposed to so many endocrine disruptors that we're seeing people younger and younger with hormonal issues. PCOS is at an all-time high, male infertility is at an all-time high. And so it's just continues to evolve. It's a huge, huge piece of medicine that I think is underserved. So I've enjoyed it. It makes a big difference in people's lives.
I mean, I guess when I think about it, obviously I'm not a doctor, but you have been my doctor for, I don't know, when did you get out of medical school?
Yeah, 13 years.
For 13 years now. And that was before I went through menopause. And so there were even certain things that you did with me, hormone-wise, with testosterone and peptides and things like that. I think originally my thyroid was off, and that's why, or I didn't realize that it was off until I came to see you. I was tired. I had gained enormous amounts of weight. So I guess that's where you started with me. And then it led to testosterone and then peptides. But after 13 years, now I've been through menopause and so many things have changed. I'm seeing, I work with skin, anti-aging on the outside, and I feel a lot of it really, now I'm realizing there's a lot of it that starts on the inside that we can't control. I mean, my question for you is, do you think it's more biological on the internal side or something external, or do we continue just working on both? I mean...
Yeah, I think it is both. I do think that, as I mentioned, people's hormones are declining earlier and earlier, and that I think is an environmental factor. However, we live a lot longer than our hormones think we do naturally. So especially as women, we start to lose estrogen before our life's over. I mean, estrogen levels start to decline in our late 40s. And usually, I think by 52, the majority of the population has gone through menopause. But it's not just about sex hormones, right? It's not just about estrogen, testosterone, progesterone. There's a whole other part of your endocrine system, right, that includes all your pituitary hormones, your thyroid hormones, your adrenal hormones. And all of these things are influenced by the decline in another hormone. They all rely on one another, right? So we have to take a very holistic approach to balancing endocrine systems. And it's everything from, avoiding chemicals and eating clean and living a good lifestyle, getting enough sleep, drinking enough water, absolutely exercising. And we know that exercise plays such an important role, not only in hormone balancing, but in your cardiovascular health and in your brain health. So I think it's both, and it always will be both. Mm-hmm. And until something major changes with with our, environment. I think that'll always be a battle. And I think there is, a lot of push toward that. I think there is a trend toward being more quote unquote green, learning to recycle, not eat out of plastics, avoiding chemicals and cosmetics. And, I think that there is a trend toward that. But it's mostly in a sort of middle income to wealthier, part of the population. So there's still a whole, a huge part of the population that's uneducated about it. And so it'll continue to be an issue.
I think that's a big key, is the education part about it, and people just not knowing, and people feeling like, in my experience being at Ageless, it was women don't realize that they don't have to feel that way.
100%.
That there's ways to, treat it. And
there's also been sort of this old adage that hormones were dangerous, that you got on and you got off as fast as you could, especially for women in menopause. And that has changed. I mean, we know now there's so much research out about bioidentical hormones and how the longer you use them, the more benefit to your health. They did a study, the Women's Health Initiative, many years ago, that was very poorly designed and very poorly managed. And they used some synthetic hormones in that study as well. They've gone back now and looked at the details of it, reviewed the study, and they found that all the women who were on estrogen in that study, it didn't necessarily cause them to have breast cancer, but if they did develop breast cancer, the women who used estrogen had a 99% survival rate. Women who did not were at higher risk for death from breast cancer. So we know there's a protective effect to estrogen. And even if you think about it just logically, how many women do you know in your 20s that get breast cancer or cardiovascular disease? None. And their estrogen's the highest at that point. So as your estrogen levels decline, you're at risk for chronic disease. It's not dangerous, and we know that using bioidenticals is very safe if done properly.
Yeah.
I mean, okay, so when we look at different classes of people, how, if a person that isn't in that mid to upper income bracket, what would be the things that they could do from where they're at?
Right, absolutely. So that comes down just to what we kind of call biohacking, right, which is kind of a trendy term right now. But really what biohacking is drinking clean water, getting 6 to 8 hours of sleep, exercising at least 30 minutes a day with a focus on resistance training, eating enough protein, eating enough fruits and vegetables, getting enough fiber, basically shopping the exterior of the grocery store and not buying anything packaged. And those are things that you can do. And even if you're on food stamps, you can buy fresh food. I think you can now even use EBT at like farmers markets. And so there are things you can do without spending hundreds of dollars on peptides and hormones and this kind of thing that can help. And I think education is really the piece, though, that's missing. And I feel like that population just doesn't get the education. And even when I was a student, we did a lot of rotations at free clinics that served either only Spanish speaking or veterans or people who just didn't have access. And those people were always so appreciative just for the knowledge, just for what we had to teach them.
Yeah, I don't think hormones in itself, maybe the consultation, but hormones, the medication itself is very reasonably priced once you're on a treatment plan. It's not like you're spending a ton of money. When people hear the prices afterwards, they're like, oh, it's doable. I mean, you just have to figure out a way to make that commitment and, know.
I mean, but some of those people, I mean, they can't, there are many people that can't. We have people on the streets and everything these days, which we did not have before. So then you look at the ones that need a roof over their head and then feed their children. And so it's that, I would imagine, would be the furthest from their mind.
Yeah, I mean, it is. It's a kind of a conundrum, right? Like, what do you do? But I think that even if we talk about the homeless population or the unhoused, I apologize for not being politically correct there. Even if we talk about that group of people, if they had access to quality food, if they had, access to hormones and nutrition and how would that affect their mental health? How would that affect their stability, their ability to work, the ability to like have housing? I don't know.
Function.
It's something interesting to think about. And yeah, now is a rough time because things are more expensive than ever, especially for people that are living paycheck to paycheck just to keep their family afloat. There's nothing in there extra. But if you're a person with insurance, it would be nice if more providers who took insurance, such as MDs and DOs, would practice some functional and cellular medicine, because then those people could have access to hormones covered by insurance.
I mean, we're sitting in the middle of Arizona, so you look at, it's not where I originally came from, Washington State, where you turn the faucet on and you can drink water right out of the tap, right? Out in the country there.
It's not that way.
My boyfriend and I were speaking about, I don't know, someone said, we're going to run out of water or something here. And I looked at him and he said, nobody's running out of water. It's just going to be very expensive.
Right.
So then that's another thing, right?
Yeah.
What cleans out your whole system, just staying hydrated and.
I think we can only hope that people continue to push back on, cleaning up the environment. And I do have a lot of hope for the next generation. I have a, small child in my life. He's only 5 years old, who he's getting a lot of education even at his age in preschool about recycling and about, not throwing trash and about, this kind of stuff. So I think that there's a lot of hope in what's coming. I have a lot of faith in the next generation and what they might come up with as far as, clean water and clean fuel and all of these things that are contributing. Regenerative farming, I think that's another thing that's really on the horizon and can make a difference.
Yeah, that will make a difference.
But yeah, it takes a lot of people to place focus on it and make an effort. And it does take money too. And the problem is we're fighting against corporations with a lot of money that are doing a lot of the polluting. And so it's a challenge.
Right.
So when you also spoke about biohacking, I know you and I had went to a conference in Vegas and it was all about peptides and things like that. And you've been involved in that since you fell out of school. Injectable peptides, methylene blue, things like that they spoke on there. When you're with patients, how do you decide what sort of different peptides? I mean, I know we can use me for an example. I know that I'm taking CJC, and then I was interested in the SLUPP, that one. So when you look at me as a whole and then the copper peptides, how, at age 57, how do all those things benefit me?
Well, when it comes to what I choose for an individual patient, it's partly based on my, intake with them, what they say their goals are, what their lifestyle's like, whether or not they have any risk factors for disease. Are they on the verge of being diabetic? Is their cholesterol too high? They have a lot of inflammation. Like, have they recently had surgery or have sustained an injury? That can influence too. So it's really dependent upon their history and what their goals are. And also whether or not they're willing to give themselves an injection or they'll only take capsules. So there's that piece too, right? And I want to meet people where they're at. So I don't want the protocol to be so complicated that they won't be compliant. So all of that goes on right in the intake. But typically, from an anti-aging perspective, I think that women and men, for that matter, need to have their hormones balanced. They need to be living a clean lifestyle. And then we need to do something to support their growth hormone levels, because growth hormone is at its highest when we're in our mid-20s, and then it starts to decline as we age. Your pituitary just gets sluggish at making growth hormone. So we can give you the stimulus. A lot of different peptides do this, give you the stimulus to make your own growth hormone at a maximum level. So it kind of rejuvenates your pituitary. It helps it to produce the other hormones that it produces, and these peptides can be used indefinitely. which is different than using actual recombinant exogenous growth hormone. There can be risks with that, and I kind of reserve it for the point where you're even in your 70s, 80s, where peptides no longer are really, your pituitary is not even responding, like it's just not capable of doing growth hormone. Then there's a benefit in using actual growth hormone, so it's kind of a timing thing. But I think that's beneficial, and then something to support your mitochondrial function. So that's kind of where the SLU comes in, right? So SLU PP332 is a newer peptide, which is designed to enhance the mitochondrial function in your muscle cells. So your muscles have the most densely populated cells with mitochondria. And so for people who exercise, balancing or optimizing that mitochondrial function in their muscles is going to make a big difference in their endurance, in their recovery times, in their strength. And then for people who don't exercise, they just
She looks at Darcy.
can't seem to get themselves to do it, or they've got too much going on, or whatever the reasons are.
Feel targeted.
The SLU mimics what exercise would do for your mitochondria. So there's a benefit for both populations.
You on
today.
that?
I'm
You on
ordering that today.
So yeah. So there's a benefit to both populations. And then there's, back to the biohacking thing, you can really generalize biohacking, like I talked about, with just, sleep and water and nutrition and exercise and all of this kind of thing. And then you can really go down a rabbit hole with it, where you're doing all this specialty testing. You're finding out what your micronutrients are, what your genetics are like, what your epigenetics are. You can test your microbiome and your saliva and your gut in your vagina and whatever it is. I mean, we can go so far down the hole as far as testing goes. There's even a lot of environmental testing you can do. So, and sometimes I think it's too much to take on, and it's not necessary. But for some people, if they have a condition that's not responding to conventional treatment, it could be beneficial. And then you can really dial in how your body is functioning at an individual level, and make specific recommendations depending on that person's overall sort of makeup.
We clearly have a lot of
Right.
things for anti-aging at
I have
Ageless
something.
Anatomy.
Let's talk about NAD for a minute,
Oh,
because
yeah.
that is
All the rage.
over social media
It
and
is
everything.
all the rage. So NAD is a derivative of vitamin B3, and it takes us back to the mitochondrial story, right? So it plays a very important role in how your mitochondria generate ATP, which is your energy source. So the benefit is that we're really supplying your mitochondria with the raw ingredients that it needs to make ATP. That's what NAD is. But the other thing that it does that's interesting, and also enters us sort of as a segue into the anti-aging realm, is that there is research that indicates that it lengthens the telomeres, which are the caps on the ends of your DNA. And those caps start to shrink as we get older, and then it exposes your DNA to oxidation. And that's where you get issues in DNA expression that can lead to disease. It can cause, some changes in your methylation pathways that can alter gene expression and cause disease, essentially. So lengthening or, kind of supporting those telomeres preserves your DNA, and NAD plays a role in that as well. So that's kind of the anti-aging edge to it. But people feel pretty good after they, use NAD, and there's so many different applications right now for NAD. For a while, a lot of people were doing IV. The problem with IV is it takes a really long time to infuse, and people feel pretty crappy during the IV. So now we've moved more towards subcutaneous injection, where you get that benefit, but you don't have to deal with the sort of uneasiness and side effects associated with NAD for more than a few minutes after a subcutaneous injection. There are other applications out there such as patches, topicals. I have not seen enough good research on that to say that that's a good method. You can use it sublingually. You can also use it as you can take a precursor that helps your body to generate its own NAD as well. And I think those are all good things. In fact, even for people who use NAD regularly, like let's say that you do a couple subcutaneous injections a week, I think in between you should take a precursor so that you're generating your own and, sustaining a good optimal level of NAD for a longer period of time.
Is that something you can be on forever? Do you have to cycle on and off?
No, it's something you can be on forever. There was some trepidation about it in the beginning when it came to cancer, right? Because NAD improves the function of all your cells, but does it also improve the function of cancer cells? There is some debate on that, but I have not seen any good research indicating that it's problematic at this point. So I think that in general, it's safe.
So I have another question. I actually had someone that's coming to see you soon that had asked me if the NAD that we sell has the precursor mineral that helps the body absorb it so it doesn't flush out so quickly. What is that?
So I'm not sure if they're referring to the precursor that you take. There are two types of precursor for NAD. There's something called NR and there's something called NMN. The NR does not have a methyl group on it that has to be cleaved off, so it's more bioavailable when we're talking about absorbing and generating NAD naturally. The other precursor, NMN, has that methyl group on it, and for people who have a genetic SNP for methylation, which a lot of people have probably had this test done, it's the MTHFR test. And which I think about 30% of the population is positive for, you're not capable of methylating. And so it's better to avoid that precursor because you can't utilize it as well as the NR. As far as the actual NAD, your body's you don't need any other nutrient to absorb it when you're injecting it or getting it through IV, or you're getting raw NAD.
Okay.
Okay.
It's good to know.
Yeah. Yeah, peptides are the biggest thing right now that people are talking about all
Yes.
over social media.
And there's so many different peptides. And I mean, there's hundreds of peptides and they're changing all the time. And, there's a battle kind of going on too with the FDA as far as peptides and what's accessible and what's not. So the thing that I would caution people against when it comes to peptides is buying them online yourself.
I was just going to say, we had a client call yesterday and say, hey, I have a friend who's getting his peptides online. And so what do you tell people when it comes to that?
So those companies can sell peptides online because they're not for human use. They are quote unquote for research purposes only. We know nothing about the sterility, what additives are in there. And also there's some discussion about it being illegal. And I think you'll start to see a crackdown on some of these places at some point because they cannot sell a product that requires a prescription to the public. And I think the way they're getting around that right now is they don't give them any dosing instructions. So they don't know how to mix the peptides, how much to inject.
Which is crazy to me that people would even inject something into their body.
But they
have
are.
no idea.
They're doing their own research, and
wild.
I've seen some pretty nasty things happen from people doing that.
It's crazy.
Really bad inflammatory reactions. I've seen people, like CJC, for example, if you inject too much CJC, it'll drop you in a heartbeat. Like you'll end up in the ER. Like people don't understand these are prescription medications, and there's limits to how much you should use. And when you buy them online, there's no direction. And like I said, we don't even know exactly what's in those.
them.
I would never do that.
Well, I mean, if I'm thinking about this now and thinking about the Life Boost coffee, how it has no mold or toxins, but then if you were to order something online, it kind of defeats the purpose if it's not sterile, and then you also are adding, just like when there's mold in coffee, if it's not sterile, and then you have all these other toxins in your body, but you think you're injecting something that's good for you, it kind of defeats the whole purpose. What's the point? You might as well go drink water and eat fruit.
Well, yeah, I mean, you wouldn't go online and order, your own, I don't know. You wouldn't go online and order your own morphine and just dose yourself however you wanted.
Right.
Like
I mean, someone addicted to it might.
But you could, but you can't, right? You can't get online and just order something like that. It's the same thing. These are prescription medications. And I would say that what they're doing is borderline illegal, selling them online like that.
Has to be. How do they even get the product to sell? That's the question. Like, where do they even get it from?
So
Mexico? Like, where's it coming from?
So you can, as long as you have a DEA number, you're registered with, the Drug Enforcement Agency, you can order API, which is like the raw ingredients that all pharmacies buy to make medications. So as long as you have that number, you can buy the raw ingredient.
They're making it themselves. Then,
and make it
basically.
themselves. Yeah.
Oh, so it's like a meth lab kind of.
Basically. I mean,
You're just brewing whatever up that you want to.
I don't know if I would go.
Oh my
I don't know if
God.
I would go that far, but
But
I
if a
think
person didn't really know what they were doing,
I think because there's such a gray area right now with the FDA, they're getting away with it. But I don't think it'll last.
Yeah.
After enough people get hurt, it'll be
Shut down.
over.
Yeah.
I mean, that's sad that people go through that don't even really realize or really are not educated, and they're just trusting someone that is safe online.
I think it's partly education and it's partly wanting to cut financial corners.
Well, it's always those people that want to jump on the bandwagon of the latest and greatest
They
and
do.
then try to...
But they don't want to spend the money to do it right.
Right.
They think that they can... It goes back to that old saying, you get what you pay for, right?
Yeah.
If
Well,
you
yeah,
don't...
and then you end up injured in some other way and
Yeah,
have to spend
right.
money for survival or something after.
Yeah.
I mean, who knows what?
Yeah. Yeah. And there's some, I had one patient that had 2 different peptides, and these were prescribed to him the way they're supposed to be from a doctor. And one of them was only a once a week peptide that you just injected once a week, and the other one was daily. He confused the 2 vials and injected the one that was daily all at once in his once a week injection.
What happened?
And he ended up in the ER. So
Oh, gosh.
it has to be done correctly and has to be guided by an educated physician.
Right, absolutely.
Well, and then even follow up. I mean, if somebody does I would be the one to make a mistake and not reading.
Yeah.
That's why I have you two to look at every single day. But I mean, it's why you have follow ups to see how things are going. And I know you draw your own blood straight out of the
Is that when you're on
downstairs
peptides, is it something that you need to have looked at every 6 months or a year? Or is it something that you're looking at blood work?
You do, and follow up might not even be as important as the initial workup. You may not be a candidate for peptides at all.
yeah.
Let's say you've got something wrong with your pituitary, and you start injecting a growth hormone releasing peptide, or let's say that you've got that you're diabetic, you don't realize, and you start using something like MK677. That's going to completely raise your blood sugar and make you, who knows, you might end up in diabetic coma. Like, you have to know what you're doing.
Oh, yeah. So you need labs first.
Right.
I mean, I worked with you for 13 years. I don't know everything that you do in your room, but it's, I guess.
Yeah, it's again, it needs to be supervised.
All right.
Any other questions or anything else you
I
want
mean,
to
I always have
leave
a
us
lot of
on,
questions,
Cain?
but
I know.
I think we're running out of time here, so.
Yeah, I mean, we could talk about this all day. We could just take one topic and go for hours when it
Run
comes
with
to
it.
functional and cellular medicine. But I think that's kind of scratching the surface for now.
Yeah. I mean, it for sure. My whole point was I wanted everyone to really get to know you, and then because I know you're really private anyway, you don't share a lot of your childhood, obviously, and things like that. Not that you have time in consultations, but it is nice to know where you came from and
Yeah.
and all about the anti-aging,
Yeah.
from the inside out, like we do. So.
Well, and I just want people to know that there is a better way. There's a way to work with your body to heal. Your body has that innate knowledge. We just have to give it the right environment to do so.
Yep.
All right. Well,
All right, ladies.
Thank you.
Thanks. It was awesome.
Like Dr. Cain said, she's just kind of scratching the surface on what all she does and for Ageless Anatomy. So thanks for joining us on our Ageless Anatomy podcast, and we'll see you next time.